Trans-Radial coronary catheterization and interventions across the whole spectrum of Allen's test results. We are here talking about a paper that's coming up in JACC, and this is a brand new paper, so it's just been posted online, and I wanted to check with Dr. Marco Valgimigli, who is MD, PhD, and the author of this study. This is something called RADAR. So first, let's talk about RADAR. What is it?
Thank you so much. I think it's a very interesting study, despite being a mechanistic single-center investigation, but I think it for the first time provides really very new information. The background is very simple. I am an obsessed radialist operator. Despite this, I never done an Allen test in my life. I have read many times that you have to do Allen test to screen the patient up front, and only upon Allen test being normal, then you can go ahead. But if you ask really expert radial operator, we never do Allen test before, and we have never seen one single ischemic completion. Right. And therefore, we set up a study which was supposed to show what we already knew before, namely the Allen test is useless. Now, it's easy to say that now, but it was not so easy when we were thinking about the study, simply because in JACC, some years ago, a brilliant, smart paper coming from Canada was showing exactly the opposite, that Allen test is actually important in predicting ischemic events if you measure lactate in the thumb. Namely, patients were not undergoing radial intervention, they were simply being occluded with the external compressor in the radial artery. They were measuring, after 30 minutes of compression, the level of lactate in the thumb. What they show is that patients having negative Allen test up front, they were having higher lactate at the end of this 30-minute compression. So the take-home message for the community is, again, do not undergo transradially if Allen test is not normal. We have, I think, taken this paradigm a little bit further, because we have included more than 180 patients. They were selected for being Allen test normally, intermediate or negative, 60, 60, and 60, that's what we were going for. And we have submitted them to transradial intervention, as we normally do. And what we've seen is that lactate was not different, and we, again, have not seen one single ischemic complication. So I don't think, again, that one single study is definitive, but I think for the first time we can say the Allen test probably is not as useful as many think. And again, on my practice, I am pretty much sure that I can continue doing my procedure without performing Allen tests up front.
So now you don't have to feel guilty for not doing it all those times before.
Correct. This study has been very useful for me, because at least I took guiltiness away. Correct.
Thank you very much. We have a variety of papers online before print, so please check it out at JACC and JACC Interventions. For Cardiol Source World News, I'm Executive Editor Rick McGuire.